Let us start with Dr. William. You are here in India at a time where we are facing a huge issue of pollution in Delhi. And I know that you are collaborating with IIT Delhi to study the air pollutants, sources of air pollutants in India. So we will start with your take on the situation, current situation in Delhi, and how bad it is.
Okay, thank you. That's a big question. Firstly, thank you for the invitation and opportunity to speak here. It's great to be here at Atria University, and great to meet colleagues from the university, and great to have a chance to speak to students as well. So thank you for that opportunity. So I'm an atmospheric scientist. I've been involved in research projects in environments that are very clean, like Antarctica, and environments that are very polluted, like Beijing. And we've done some work in between as well, including in Delhi, as you say. I think there are a few things that it's interesting to discuss, and I'm thinking about interests of colleagues as well. We've done quite a lot of work understanding the causes of air pollution in environments like Delhi. We have a pretty good understanding of what goes into the fine particles in the air, the PM 2.5, that are driving the current challenges. Some of those are natural, some of those are dust blown from elsewhere, for example. Some of them are linked to human activities, whether that's industry or combustion for heating or cooking or agriculture, stubble burning, etc. So we know about some of those things. There's probably a challenge for us as society in terms of setting good regulations and enforcing those regulations. And that's maybe something that it's interesting to talk about. Probably next to that becomes a challenge of behavior and of how we support organizations and companies and individuals to change their behavior. And for me, one of the starting points for that is awareness. And one of the really interesting things is everyone carries one of these nowadays. And increasingly, we get individual measurements of pollution on our phones. And we're just beginning in the science to understand how our vulnerability, how our risk differs, depending on our personal health, our genetics. So I think our three topics today, pollution, genetics, and health, they're very much linked across. And it might be interesting to think about that individual vulnerability as well as that population vulnerability. And then I think there's a final governance bit. And to date, we've often said air quality should be better than standard X. It should be better than a target. But that's not what the science says. The science doesn't say it's bad here and it's good here. The science says there's health benefit at all levels of air quality. So if you were to design a policy for the best health, it might look different from a threshold, and it might look different for different people. And that's quite an interesting thing to think about. So there you are. That's lots more questions than answers, but maybe that starts us off. Yeah.
Thank you.
Yeah.
So my question was like, as you said, for example, in Delhi or any other city, like we talk about sources. So like how you estimate like the thing called like source apportionment, what they call. So like how do you know like, okay, this much percentage is coming from, you say, crop residue or fossil fuel or industry, like what goes into the, say, analysis part of it, or like, can you comment on?
Yeah, absolutely. Yeah. So how do we know where the pollution comes from fundamentally? So we can collect samples of the air, collect the fine particles in the air, the PM 2.5. We collect them on filter papers and we can analyze them offline using instruments in the lab. And we can measure the chemical fingerprint of different sources, and they're distinct, they're unique. So we can say pretty confidently what proportion of the PM 2.5 comes from biomass burning, comes from crop combustion, comes from plastic burning, or comes from cooking and industry. So we can do that pretty well. It gets a bit more complicated because some of the particles in the air evaporate and some of them condense. So it actually changes with time. And we need to know a little bit about that physical and chemical processing. that we can apply those techniques to do that source apportionment. The new exciting thing is doing it in real time, doing it online. So rather than taking samples back to a lab, measuring in real time online and getting a real time assessment that today the air pollution was driven by fireworks last night, or today it's been driven by air being blown from the IGP into Delhi, or whatever it may be.
So that kind of instruments are like, is there already, or
They
is like
are just about there now, and part of it is an instrument problem, and part of it is a data processing problem.
That's what.
Yes, is the short answer. So the meteorology, the weather. So yeah, that changes through the seasons. So you have the cold, which causes a certain amount of combustion linked to people staying warm. You have the stubble burning season from sort of mid-October through November across the IGP, and winds bringing that air into Delhi. You have some of the industry that's now been moved out of the city into the surrounding sort of periphery of the NCR region, and advection of pollutants from there in. And and then you have dust events more in May, June. So when you get into the dry period, dust is a bigger proportion of the PM 2.5. This time of the year, it's primary sources, it's combustion sources. And then in the winter, the colder weather also, it reduces what we call the boundary layer. So the height of the air within which the pollutants mix. So you have the same emissions, but a smaller bucket of air in winter, so the concentration is higher.
Yeah, my question is to Professor Crow. So as you are an expert in epidemiology and health data, I would like to know, is there a correlation between air pollution and health conditions like cardiovascular diseases, cancer, etc.? And how actually we can use health informatics in understanding and reducing such risks like air pollution, which could be causing or aggravating these health conditions?
Yeah, so I think that data, health data and environmental data play a big role in it. I noticed that the schools were closed, and so obviously there's an alert that goes out to close down schools. And similar alerts could be notified to, hospitals and other units for saying, so we need to use the data to understand what happens when these environmental changes are happening, when there's more dust and more air pollutants, and what's the effect on people presenting in hospitals. So we know that it exacerbates respiratory illnesses like people who have asthma, and then also people who have a condition called chronic obstructive pulmonary disease. Also, there are effects on cardiovascular disease, and so things like acute asthma exacerbation, so when people encounter real trouble breathing, and so they have to go and seek healthcare. So we need, to have better health surveillance systems in place to alert hospitals for peaks in presenting, and then also we can focus on obviously at a public level, a population level, but then there might also be alerts to individuals, maybe for those who have asthma, thinking about what at an individual level they might be able to do to help them from preventing needing to be hospitalized. I think also there's a need to have better understanding of environmental and temperature impacts on things like mental health conditions and exacerbation of some of those conditions as well. And that's an area of ongoing research that we're trying to develop in the UK. We've got really good environmental data. Not that I have actually worked on that because I mainly focus on health data. I think we run into problems where we come to link some of the data because of data governance issues, because we have access to anonymized records, but we're not able to link that with regional data because we might risk identifying people. So we come into to problems with data governance issues. But yeah, I think that there's a lot more that we can do with the data that's already being collected, and obviously it requires a lot of ongoing collaborations between health data sciences, hospitals. But I think that there's a lot of potential to reduce kind of the population burden of some of the.
And I think for these, personal data is very important because some people will have a genetic vulnerability towards some diseases.
Mm-hmm.
When the environmental condition sort of goes bad, will be pushed,
Yeah.
especially. If you have a gestational diabetes, people say that the chances of you being diabetic is higher,
is
actually.
very
Yeah.
high. Yeah, and so obviously again, there can be population health
Yes.
strategies that we can try and implement, but then there's also obviously there is some onus on an individual. But I think at a population level we need to be doing more. Unfortunately, when you've got pollutants in the environment and you're trying to encourage people to go out and exercise more, so it's very complex, and we kind of need to map out systems to actually say, well, if we encourage people to exercise, what's going to happen to, say, the effect on their respiratory system? So we do need to think more broadly about the impact of some of these recommendations we're having.
Yeah. Thank you.
I think you have touched upon quite a lot of areas, and in your question. So I will start with basic questions you have asked, given multiple different data sets. So we've been talking about air pollution data, environmental many measurements, then the clinical measurements like multimorbidity, if the patients will already have some kind of other diseases. And then you talked about a little bit of molecular data, which includes maybe genomics like transcriptomics or maybe proteomics or metabolite profiling kind of thing. Ideally, given their same population, let's say X population, and we measured each and every single people from this population for all the measurements, ideally we could do some kind of integration about those. Yeah. Now the problem is they are genetically very different, probably, and they will have a multimorbidity in general. I mean, it depends on the age, it depends on other factors. So, and data is huge. Now, when we talk about the data is huge, in definition, the number of population, but also when you bring the genomics component, it becomes more and more bigger because your measurements are getting bigger, not like a one gene target. You don't know what is your target. So first thing is that, can you discover the target? Yeah, and then the second question would be, if the target will be translational. That is the next question, okay? And which the surgeons and medical doctors will be very, very interested if this is translational. So just coming back to the first issue, where is my target? So ideally, you will find target from the air pollution data. Maybe you find one of the measurements are actually variability explaining around 80%, 90%. You may not need around 100 features to measure, or maybe those measurements are correlated. Yeah. In the genomics, it happened quite every day, for example. So if you measure like a single cell RNA sequencing, or maybe measure RNA sequencing technology, what you see, many of the genes are linked, right? I mean, very much correlated. So meaning they are doing the same thing, but they have two different versions. So one of the things would be prioritization of those genes. Let's say, there are many ways we can do it using AI. There are algorithms in the literature, and so let's say we don't need to have 15,000 genes. We can say, let's say 10, 15 genes, and each of them. So we call it multimodality of our data. So data is coming from clinical features, data is coming from the population level, individual level, nutrition level, even. Like how people are eating every day, if you can measure that. Then we could link them or associate them, but again, this is just an association, simple correlation type of things. Yeah. Again, it doesn't tell if the question you have asked, if the gene is, still don't know gene A will be causing that factor, because it's not a causal link between that. So in AI terminologies, we can use some of the algorithms to identify like causal link. But for validation, we have to design some experiments, especially on the gene target, like overexpression of the genes or maybe the knockout of the genes, and then see if it is actually happening. So that's one part of it. Now, there are a lot of challenges doing it. First of all, the AI methodology, which is available in nowadays, like deep learning, transfer learning kind of algorithms, they need a massive amount of the samples. Yeah, and those samples sometimes is very difficult, because not necessarily I mean, for example, I mean, it will be unrealistic if someone is saying me they have done RNA sequencing for 3,000 patients just because of the cost and how you're going to manage that. Yeah. So automatically the dimension of data become very huge, a lot of measurement. But if you look at the samples, maybe you are targeting 50 samples, and this is a major issue nowadays. Yeah. And then you also ask one of the question regarding if we can, how we make the decision. I mean, should we stay there or should we move out? I mean, I think this is very difficult question, and this needs to be validated not only one region, it needs to be validated in multiple different regions. It is possible this region is very unique, but then question would be, can we compare with multiple other countries maybe? But then you are imposing the genetic diversity. I think Professor Williams said that Beijing as an example, I'm just trying to get back there. So if you compare the Beijing situation with Delhi situation, of course maybe similar in terms of the circumstances, but if you look at the population, they are ethnically different, they are very different. So you are actually kind of using linkage disequilibrium in the genetics, some sort of a confounding factors and other things. So that's the one part. You have also talked about the diagnostics. Now, if you cannot identify the target, it is very difficult to get the next level, in the diagnostics level. Even more difficult because diagnostics need to be maintained by quick, cost-effective, top of it. When a patient don't like to be waiting for 2 days for your experiments, it will be very quick and then cost-effective for the demographics in a kind of thing. So I think still there are a lot of challenges. I mean we are not yet there, but AI is just a tool. Given you have this population, maybe they can give you a little bit of advancement, but still the interpretations and your validation need to be working together with interdisciplinary areas. Yeah, so people need to be coming up, like a clinical community, life sciences community, like experimental biologists and AI-driven kind of thing. So it needs to be culture like that, in my opinion. Yeah.
So that means we are at a very nascent stage of this integration process right now. Still.
Yeah, that's interesting. I'd like to just pick up on something Francesca raised, actually. She mentioned the mental health impacts. And we know quite a lot about the physical health impacts in terms of cardiovascular system, pulmonary systems, etc., and the biomarkers for that. We know that there's an impact of pollution and air pollution on cognitive function and maybe on cognitive decline, but we don't know how big that is. And it could easily put a zero on the end of all the damage costs. And we've done some experiments at Birmingham. They're really, really simple tests with our environmental sciences and our psychologists. You can ask students to sit to tests or exam papers in a room with a candle burning and a room without a candle burning. And people perform worse if there are particles in the air from just a simple combustion source of a candle in the room. And you can extrapolate that to the population and impacts on productivity, etc. There's even been papers published saying that stock markets show some correlation with pollution in the air. So there's a whole load of stuff out there that we don't understand that really could be quite far-reaching.
That means my daughter says it well, that there should not be any exam at the festival times. Thank you all for the answers. So following up on both Asha's and Akshi's question and the answer that it's a question for all three. So, like said, Professor William said, it affects cognition. We know that climate change, even heat stress can affect cognition. And most of the studies which focused on cognitive decline caused by air pollution focused on PM 2.5. And they said, and it has recently been implicated in causing neurodegenerative diseases like dementia and Alzheimer's also. So, the samples were people over 40 in those studies, and we fairly don't have an idea of how it affects area development. So, from that point of view, Dr. Anish suggested that it's very difficult to find the candidate genes using the data available now. So, what if we take data from existing knowledge on cardiovascular, respiratory diseases, and neurodegenerative diseases, and use it to screen candidate genes first using AI techniques, then focus on that in diverse group and ethnicities and move forward like that?
Yeah, this is a very good question. Yes, so that's what many of the projects or many of the disease area we are working on, looking at the target, and we call it as a guilt by association. So if A is a target, if something you find associated with B could be also potential target as well. So and as you said, looking into public databases, yeah, and looking at those genes and trying to understand how the mechanistically those are, because they're already defined as a marker. So if you define as a marker and we kind of enrich around those markers, how the mechanism is going on. So that will give us a little bit of understanding about the mechanism. I mean, for example, if I'll give you PPAR alpha gamma, like a master regulator for adipogenesis, and also implicating type 2 diabetes, also cardiovascular disease as well. So then we have a better understanding. But for A gene, probably it is fine, but the B you have identified, for that you need to have some kind of a validation type of experiment. So I'm kind of emphasizing some kind of a experimental validation is mandatory of these kind of scenarios where we can discover one gene from another one, taking a little bit of information. In terms of the AI, we are talking about the ontology nowadays, knowledge base, meaning that we, based on the PubMed, based on the literature evidences, based on the internet resources, can we develop some knowledge graph saying that, okay, and if we know a gene, yeah, what are the people talked about those genes in the paper? Can we do a natural language processing around those genes or on those PubMed? For example, if I ask someone who is very much competent in the computer science that, okay, I want to have last 20 years of the data in the PubMed talked about gene A, I am also interested to find out where A is interacting. Yeah, so that might gives us a little bit of idea about hub genes or hub kind of areas where we need to focus on. We cannot focus on everything, but we can focus on some of the things, and we can prioritize how many hubs, how many things people talked about they're interacting in the literature. So that's what people are looking at the moment. However, taking this knowledge, again, you have to validate some extent. Either you do a kind of a cohort study or you do some kind of a targeted study, those type of things. Yeah.
I'd like to sort of touch on what you just said and then what Bill said about the really good understanding of the environmental impacts on cognition and the future work that can be done. And then also bringing in another discipline of economics. So obviously with, the amazing, I've been visiting India since 2009. And I've seen incredible economic development, and obviously with the environmental impacts of industry, and obviously in the UK we were allowed to, in the Industrial Revolution we polluted the earth, and we were allowed to do that for a very long time. And now there's a lot of pressure on governments in countries like India and China to reduce their pollution, but actually taking that kind of impact on cognition and actually bringing in the economics and saying, well, actually, if the pollution is reduced, productivity increases, and that's better for the economy. And just trying to bring in another area for making change.
So less pollution, you'll be more productive.
Yeah. And obviously, because obviously the kind of the industry is, well, if we reduce the industrial pollution, that's going to affect the economy, but actually trying to bring in the effect on productivity as well. Yeah, that's. Oh, thank you for your question.
Thank you very much.
It was really great.
It was great.